The FDA approved the first ever over-the-counter birth control pill available without a prescription.
Our 9 News health expert, Dr. Payal Kohli, of course, joins us now to talk more about this. This is groundbreaking, Dr. Kohli.
It is incredible. In the medical community, we cannot celebrate this enough because, it doesn't just improve access, obviously, to oral contraceptives in the era of Roe v. Wade being overturned, but it also signals a paradigm shift where we're actually trusting the health consumer more. We're putting, the power in their hands. And for example, us as cardiologists, we're hoping that statins, which are cholesterol medications, are next, because we know one of the barriers to getting these medications is visiting the doctor or getting a prescription. And so I think this is incredible.
Are there concerns about allowing birth control over the counter, though, without a prescription?
Yeah, there are. And the FDA advisors really heavily weighed this because when you think about birth control pills, they can potentially have some risks. So I would say the biggest concern, obviously, is health literacy, especially because we think that adolescents may be accessing these medications as well. So we want to make sure they understand how to properly use them, because this particular medication has to be taken within a 3-hour window every single day for it to really be very effective. We also have to make sure they don't think it's like a morning after pill, that you go and get it after you have, unprotected intercourse, and it might help with an unwanted pregnancy. There are, of course, contraindications like with any medication. So anyone who's had breast cancer, blood clots, anyone who's taking other types of hormones, those types of people shouldn't be taking this. So educating people about the correct use, I think, is going to be the biggest concern moving forward.
Certainly important there. And of course, how much is this going to be costing, and what is accessibility going to look like, and when's it going to be available for people?
We're thinking Q1 or Q2 of next year, of 2024, is when it'll be available. The nice thing about it is it'll be in supermarkets and gas stations and pharmacies, really anywhere that we go to get our Benadryl or our Tylenol. But here's the challenge. It's going to cost something when it's available over the counter. Whereas with insurance, most birth control is actually free. And so really the American Medical Association is talking to a lot of insurance companies to see if they can make it over the counter, but still free, so that you wouldn't actually have a cost to it, because you certainly don't want cost to be a barrier. And if they price it too high, it is going to be.
From what I understand, there's no age limit on who can buy this. Can this cause health problems aside from it not working for unwanted pregnancy? But if you overdose or something on it, can that cause problems?
Yeah, and so it has progesterone in it, which is a synthetic hormone. It changes our uterus lining, it changes our cervix, it changes our ovulation patterns. So misuse of it, for example, if I was taking 2 or 3 pills a day, that could be an excess exposure to the hormone estrogen. That could certainly potentially impact my fertility, my reproductive health, my blood clot risk, all of those types of things, cancer risk. So it's going to be really important, again, because there's no age limit. You can get it, you can walk into a pharmacy or drugstore and get it. You really want to make sure that people know how to use it. And I'm hoping that the next kind of 6 months before it hits the market, we really focus on education and teach our kids how to use it, because having the conversation now is important.
Yeah, education is so important. Dr. Kohli, thanks so much for coming in.